Hello, my name is Sara Blunt, and as the Chief Executive Officer of Kalyra, I want to update you on everything we're doing to prepare for COVID-19. You can be reassured that Kalyra is highly experienced in preparing for and managing epidemic diseases like influenza and gastro. And right now we're working with state and federal departments to ensure we have the best available advice for COVID-19. Our founder, Jessie Brown, set up Kalyra to provide services for people in need, and we've been doing that for 128 years. We've provided services through the polio, tuberculosis, epidemics and AIDS crisis, and we're exceptional at providing services that people need in these difficult times and in managing infection control. We don't panic, we breathe deeply to steady ourselves, and we pay attention to the facts and the precautions required to protect ourselves and the people we care for. So what are we doing today? Well, to begin with, we are not in lockdown at this point in time. Yes, we are being sensible and cautious by limiting our visitor access to our aged care facilities, and our retirement villages and affordable housing sites are being cautious with good hand hygiene, social distancing and avoiding group activities. We have enacted our epidemic policy and procedures, and this means that our pandemic response team of experts is meeting daily to plan and manage our response. We are keen to ensure that what you hear from us about COVID-19 is based on the facts. In residential aged care, we are limiting visitors to 1 visit per resident, with a maximum of 2 immediate family members, close friends or health professionals. And if you've travelled overseas in the last 14 days or are feeling unwell with any cold or flu symptoms, the message is clear. Don't visit. Everyone must wash their hands on arrival and when leaving. Volunteer group activities like bus trips and movie afternoons have been suspended, but volunteers and community visitors who visit particular residents who may not have relatives close by are still very welcome. Staff have been refreshing their universal infection control measures, and we are managing our rostering to minimise unnecessary exposure. Our Help at Home team is well prepared to continue providing services in the community, but we are asking clients to let us know if they become unwell before visits. We are maintaining our stocks of masks and glove and hand wash, etc. quite carefully, and as a vulnerable group, we have priority access to additional supplies when needed. And remember, the most important thing that you can practice is good hygiene. Wash your hands, avoid touching your face, and keep a respectable distance or social distancing, and stay away if you're unwell. We'll be updating our website as new information comes to hand. And most importantly, I ask that you keep looking after each other and remember that we are doing everything we can to protect our Kalyra community. I strongly advise you to limit watching the news and social media. The government is putting out great advice through the Department of Health website, and you can always ask us if you're concerned. Thank you.